Hi everybody, it's Nikki McLaughlin and I am here today to talk to you about government entitlement programs. And everybody knows that these types of programs kind of stay in the media and in politics as hot topic buttons where Congress can save money, where people can make the most change, and so they're often discussed with regards to debates and basically this talk and how we can make things better. So this is a general outline of what we're going to go through today. What are government entitlements? What programs are included in the government entitlement umbrella? And then each of the three programs, Social Security, Medicare, and Medicaid, how are each of those funded? What are some of the challenges that face those programs? And is there any possible solutions? So foremost, this is a definition of government entitlements, and it states that an entitlement program is a type of government program that provides individuals with personal financial benefits or sometimes special government provided goods or services to which an indefinite but usually rather large number of potential beneficiaries have a legal right. So what programs are considered to be government entitlements? And the three on the left-hand column, Social Security, Medicare, and Medicaid, are the three that we're going to talk about today. And then on this other side that you can't see all of, they are welfare, unemployment benefits, and then the last one where I think my face might be is food stamps. So we're going to start with Social Security. And so Social Security was signed in 1935 by President Roosevelt. And at that time, he made this long quote. And basically, to sum it up, it says that the intention of Social Security is not to ensure 100% of 100% of the population against the bad things that happen in life. We're just trying to be able to provide the average citizen with some amount of protection should something happen. So facts and stats on Social Security at the end of 2014, that is where these data are being pulled from. So at the end of 2014, 59 million Americans were receiving either disability, old age insurance, or the widow and orphan insurance as you see on your screen. And that came at a price tag of $848.5 billion. And so, as I just kind of briefly mentioned, Social Security is not a retirement savings plan. What it actually is an insurance program that helps protect workers and their loved ones against life's unknowns. And then it also provides benefits, which I also briefly mentioned, that it also provides benefits not only to the old retirees, but also to widows and children, as well as those that are permanently disabled. So how is Social Security funded? And the answer is FICA taxes. So currently, contributions to the Federal Insurance Contributions Act, or FICA, those four little letters on your paycheck stub, this is where all that money is going. Currently, there is a withholding of 6.2% from you, as well as a contribution of 6.2% from your employer, for a total of 12.4% of your income that goes into fund Social Security. Now, historically, here we go. Historically, Social Security was kind of a pay-as-you-go system, and all benefits were paid from the revenues that Social Security took in. And so this is how the income and the revenue that we put in as employees and employers goes into the Social Security Trust Fund. And then from there, the benefits are paid out to survivors, dependents, disabled persons, whoever is going to be benefiting from the trust. and then any surplus that is received or accrued in interest goes back into the Social Security Trust Fund. So in 1983, Congress raised payroll taxes, and it was kind of a preparation for the baby boomers and this large onslaught of the aging population that we are kind of now in the beginning stages of. And so for almost 30 years, the system took in more money than it paid out. And so at the end of 2010, there was a total of $2.83 trillion in excess funds in Social Security. Now, the issues that arise with the future of Social Security largely involve that trust fund and people's beliefs about it. So that gets us to our next question of, are we in trouble? And so I kind of briefly alluded, it's kind of a loaded question to ask. It really depends on how you define trouble and if we are truly broken. So as I mentioned, we had this $2.83 trillion trust cushion, if you will, that we have now started to pull from. Last year, negative net cash flow was about $74 billion, and then this year it is estimated that we will be up to $84 billion in negative cash flow. So why do people think that this means that we are broken? The most common myth that I came across when doing research for this was that Social Security was going to go bankrupt, or that as employees now, we would not be able to reap the benefits of Social Security when we get to retirement age. But since the Social Security benefits are actually paid from the revenues for that year, it is technically impossible for Social Security to go bankrupt. What most people are concerned about is that when this fund runs out, which is predicted to happen in 2033 or 2034, Social Security will no longer be able to pay out the amount of benefits that people are currently receiving. So when that happens in 2033 or 2034, Social Security will only be able to provide about 75% of the benefits that they currently pay out to their beneficiaries. So is there any way to fix this? And there has been several propositions, and people have all sorts of creative ideas on how to fix the Social Security system. And these are just a few of the options that I found, which would be changes to the cost of living, which is also a factor in calculating the Social Security, raising the eligibility age, and then changes to FICA taxation on the end of the employer and the employee. So moving right along to Medicare. So Medicare was created in 1965 by President Lyndon B. Johnson as an amendment to the Social Security Act. And under Medicare, President Johnson believed that we were going to have this great social reform and that he was going to remove poverty and racial injustice. And I just found that this quote was very interesting and also very true, because it is very important that Medicare is able to take care of Americans as we continue to age. And I think that most people would agree that we don't really care how it's structured, as long as it works. So facts and stats on Medicare. So once again, this is 2014 data. So at the end of 2014, there were 55 million Americans age 65 and over or with permanent disabilities that were receiving Medicare benefits. And that comes at a cost of $597 billion. So where is this money coming from? And yes, you guessed it again, FICA taxes. So in addition to the percentage that is taken out of your check for Social Security taxes, there is a contribution of 1.45% of your salary from you and 1.45% of your salary from your employer that goes into funding Medicare. In addition to those FICA taxes, a large portion of Medicare also is financed by general revenues. Premiums, those are from the Medicare plans that actually have, they're like the Part C, the Advantage plans that have the additional benefits. So those plans that have premiums, and then any interest that is accrued goes back into the Medicare fund, as well as taxes on Social Security benefits go into Medicare. And then all of those monies are separated out into two trust funds, the first of which is the Hospital Insurance Trust, and the second is the Supplementary Medical Insurance Trust. And the Hospital Insurance Trust pays for Part A coverage, which is your in-care hospital care, skilled nursing facilities, hospice, and let me think what the other one is, or look at it, I guess I should say. Home health care is the other. And then from the Supplementary Medical Insurance Fund, that is your Part B Medicare coverage as well as your Part D Medicare coverage. And then both trust funds work to fund administration costs and anything that is fighting, fraud and abuse of the system. So is Medicare in trouble, and is Medicare broken? And once again, there is definitely challenges that we are being faced with that need to be addressed. Historically, Medicare spending rate was an average of 7.5%, and that was from 1969 to 2013. However, in the past 5 years, between 2010 to 2014, spending has slowed down to 4.1%, despite the number of beneficiaries increasing and in spite of the healthcare costs increasing over these years. And you might be thinking about what effect the Obamacare has had on changing these numbers, but even with Obamacare, the projected spending for this year is about $1,200 lower per person than it was expected to be in 2010 after Obamacare was passed. So even though spending is down, the Congressional Budgeting Office is still concerned with the spiraling of healthcare costs with regard to technology and new interventions that are available. They're also concerned about greater use of medical services by the beneficiaries and the aging population. And so therefore, Medicare spending is projected to increase from $649 billion this year, 2015, to $1.2 trillion in 2024. So how can we fix this? Once again, there's been a lot of different opinions on how to fix this. These are 3 of those, and the most interesting that I might say that I found was to go private insurance, which means that they would pay the beneficiary a lump amount of money to then go and buy a private insurance policy. So last but not least, I see that I'm running out of time, so I'm going to move a little bit faster, and I do apologize. Last but not least is Medicaid, which was actually also signed in 1965 by President Johnson at the same time as Medicare, as part of that social reform in an effort to rid the country of poverty and injustice. So facts and stats on Medicaid. Last year, it helped 80 million Americans over the course of the year and cost us $458.6 billion. So how was Medicaid funded? And this is the only of the 3 that does not use FICA taxes. Medicaid is funded with state funds, and they are matched federally at least $1 to $1 for the amount that the state spends on their program. And I just mentioned that. And so are we in trouble? And the answer to this, I think most people would agree, is yes. There is room for improvement across the board with Medicaid, and some type of reform needs to happen